Okay, hello to all the amazing community health center staff who are tuning in to watch this advocacy update video for the month of April. For those of you that are new to the call, my name is Michael Abramson III, and I'm the current Director of Legislative Affairs over at the Arizona Alliance for Community Health Centers. And today we are diving into, once again, both state and federal updates. We're talking a whole lot about money and dollars, and we're talking about bills. And of course, if you want to do even a little bit more than getting informed with these videos, we will touch on that at the end. So yeah, let's get into it. So the end of March was the final week for bills to be heard in their respective committees. At this point, bills will only be heard on the House or Senate floor, and they will then be transmitted to the governor's desks. So all bills that have made it this far are nearing their final stops. And just to highlight a handful of those bills that have made it across and are at the finish line, we can look at HB 2173. This is a bill that would prevent any health professional regulatory board from asking an applicant about whether they have sought or received mental health services. We can look at SB 1124, sponsored by Senator Shope. This provides a process for dental assistants to become an OPA, and establishes the scope of what an oral preventive assistant can do as well. That's really to look at and kind of add on to the workforce there too. And we can even look at SB 1102, which looks to prevent, my apologies, the practice of non-medical switching, a practice by PBMs where patients are typically forced to change medications for reasons that aren't related to their health or safety. And with the end of the committees, we also see a shift into budget conversations where, again, we're talking about money, we're talking about the dollars, and where the state is able to throw dollars at looking into our next fiscal year as well. So on this slide, we have three of the highlights that the Alliance is watching and paying attention to as well. Now, these did appear in bill form, but to talk about the potential appropriations or dollars, we are following along with a potential amount of $15 million that would go towards access to increased outpatient behavioral health fee scheduling. We are looking at dollars that would go towards GME programs, and we're looking at dollars that would go towards comprehensive dental care. Currently, we have coverage for emergency dental care for adults, and it's looking to make that shift towards comprehensive care as well. But as you can see by what we have pictured here, there's a lot more dollars that we need if all of these things were to get properly funded. So we'll see what comes out towards the end of this legislative session. Now to jump into some of our federal updates. So last month, I talked a little bit about both budget resolutions, continuing resolutions, and budget reconciliation. Congress now, between two separate votes, one on April 5th for the Senate at like 2:30 in the morning on a Saturday, and an additional vote on Tuesday, April 9th, has officially opened up the door to the budget reconciliation process. So both the House and Senate have now passed a framework, as we can call it, or a blueprint to what the federal budget can be, and they've both agreed on what that framework looks like. Because they passed that framework, in both the House and Senate, they can go back to their respective chambers and begin to draft legislation that specifies exactly where dollars for the budget may grow. So finally, Congress will have to specify exactly where they plan or plan not to make cuts. The concern from a community health center from an alliance standpoint is that the size of the cuts promised in these frameworks would have very negative implications on public healthcare buckets like, yes, Medicaid and Medicare. Now, Speaker Mike Johnson is aiming to have the House be prepared and voting on these budgets by or even earlier than Memorial Day. So it is as important now as it has ever been to continue to engage with our congressional members and educate them on the importance of community health centers and this Medicaid funding. And so just to really drive home that we definitely still have some time to continue to do our advocacy, where we just passed is that first bullet point that you see listed there. The House and the Senate have officially agreed on a framework. We are now transitioning into committee bill development, and this will take place over the next couple months. And this whole timeline here that you are looking at will have to be wrapped up by the end of September. So again, there is plenty of opportunities to continue to advocate and highlight the importance of funding Medicaid. And again, as always, if you want to continue and participate in our calls to action to our congressional delegation, we encourage you to scan this QR code and you will receive those updates to your email. If you have questions that you would like to see answered in these video formats, go ahead and send them over to that email and I will be happy to address them on these monthly calls as well. But thank you, and until next time.